Osteoarthritis is a degenerative condition of the cartilage where the cartilage progressively breaks down. It happens over the course of years and decades, and it can happen for a lot of different reasons.
Some of the common ones are if someone's in a bad car accident or has like a sports injury. Another one, which unfortunately is a little bit of a common problem in the United States, is if you're overweight.
The lab is really focused on this problem of osteoarthritis, both from a standpoint of disease and detection, as well as treatments. And I think if we can do that, I think we can really make a difference in patient care. And that's what's really important here.
One of the difficult things for physicians in diagnosing osteoarthritis in its early stages is that the cartilage tissue doesn't show up very well using conventional x-rays.
You'll see the long bones, but they won't see the soft tissue, i.e. the cartilage that's on those bones. And that's very limiting. It would be great if you had a quantitative way to assess the stage of the disease.
Here's how our technique would work. You would inject a contrast agent, and then the contrast agent would diffuse into the cartilage, and it would make the cartilage light up via CT scanning. And it would also give us some information about what spots are healthy and what spots were starting to degrade. And that would, give the physician really valuable information on treating arthritis for the patient.
Unfortunately, when you still progress in OA, the only real long-term treatment is a joint replacement. The downside is that their lifespan is only about 15 to 20 years. If people start coming down with osteoarthritis at, let's say, the age of 40, it'd be nice to delay their surgery need until they're in their 50s or 60s ideally. So one of the things that we're working on is a polymer solution that could be injected in the joint so that it helps restore the natural lubricating ability of the joint that's compromised during arthritis. So then they'd only need one joint replacement and then they'd be fine for the rest of the duration of their life.
Arthritis is one of the things that you might not die from it, but it really makes a big difference in terms of how happy you are, what your quality of life is. And so for me, it's really important to make sure that that quality of life is there for people in their later decades of life. And that's really the goal of the project here.